Successful transformation in government services is ignited by leadership and propelled by collaboration. The Maryland Total Human Services Integrated Network, also known as MD Think, is the first in the nation cloud-based platform revolutionizing the way Marylanders receive service across the spectrum of health and human services. Christopher Shank, the MD Think Committee Chair and Senior Advisor to Governor Larry Hogan, is laser focused on carrying out the state's commitment to utilizing modern technology and data to improve access to critical government services and impact citizen outcomes.
Hi, my name is Chris Shank. I'm a Senior Advisor to Governor Larry Hogan of Maryland. I currently oversee all IT operations and strategy for our cybersecurity, data, privacy efforts. In the capacity that I'm acting in right now, I serve as the governor's designee on MD Think as well as its chairman. One of the things that we discovered very quickly was there was a tremendous technology debt at human service agencies like the Department of Human Services. Our main goal was to look at our internal operations at the Department of Human Services and make sure that first and foremost we were able to get rid of some of these siloed data operations that we had. Then we wanted to look at building a platform that could be scalable across our human service and health enterprises so that we could ultimately use this data to improve our decision making and get a 360 view of our constituent. Then we wanted to look at making sure that we were providing services from a better perspective from a customer service aspect. Finally, we looked at it from the caseworker perspective, making sure that our caseworkers had access to this data, that they were able to be nimble and utilize the data in a more effective way than they were prior to that. A tremendous amount has been accomplished so far with MD Think that we're very proud of. We've just reached the point where we're 100% modernized with our Department of Human Services, with the last module being child support being fully implemented statewide. So that means the original agency that we started with is completely 100% modernized. Right after MD Think got initiated, one of the things that the team here in Linthicum did was making sure that they had really socialized this among the front lines. So they went out, they personally met with a number of the caseworkers, and I've been very impressed with the feedback that I have heard. I'm a former legislator, so I wanted to hear it with my own ears, so I convened a group and listened to what they said. Just some of the benefits to them in terms of being able to not have to go back to their offices at 2 a.m. when they visit a hospital, to be able to get that information immediately, to better help them with document management so that they're spending more time interviewing their constituents and their customers and less time on paperwork and other type of mindless activity. Cardinality has been a key partner in developing this ecosystem that is MD Think, and we very much appreciate they've been extremely responsive. They've been very flexible in helping us derive a lot of the value out of this platform by using it to look at some of this data-driven decision making. Very creative in terms of the way that they've approached some of the business problems and really helping us connect the technology and the data with looking at the outcomes. So we really very much look forward to continuing that with Cardinality and making sure that we're able to really gain insights and leverage that data.
Cardinality is honored to have partnered with Maryland to implement a modern platform that provides a holistic view of citizens receiving benefits. Contact us today for a demo to learn about a better way of leveraging modern technology that delivers real results.